This whole process of recognition, where we go into the workplace, what we call work-based assessments, has definitely helped the section, the teachers here, to enhance our partnerships, our relationships with industry, because we are able to meet with managers and coordinators and kind of talk about our new flexible image.
Just the other day I was talking to TAFE again, and that was related to some modules which we can work on in a way which will help our advisory committee members to be better or more productive. They have got immense knowledge as well as skills, but how to put it in the Australian workplace within the boundaries of those.
We were approached by Auburn MRC to actually look at how we could, develop a fairly flexible program for delivery, to look at workers who clearly had the skills because they're doing the jobs, but as Anne just said, needed perhaps some gap training and looking at being able to provide the actual qualification.
It was important for us to kind of either enhance the relationships that we had, or in some cases we had to establish and build those relationships.
There was the driver from Auburn Migrant Resource Centre that wanted credentialed and trained workers. They had a demand from the community for newly arriving migrant groups. They had people who were experienced in life, but they needed them to have the gap training and also to have the formal qualifications recognised. Personally, a lot of the students had personal journeys where they wanted to go to uni, but they couldn't go to uni unless they had a certificate in Australia. So that was a driver for them to do it.
I had to struggle a bit because I didn't want to go back to say I have to go through all that study again just to get myself somewhere, because you've got families, you've got other commitments that you want to look into life, not only just being studying. So I was very fortunate to get hold of Granville TAFE in a way that they provide a bit of that entry to get into the course that I wanted to do, because I'm currently doing a postgraduate diploma in social science, community services, and I'm intending to continue to get my master's.
I was trained as a high school teacher back home. When I came here, I suddenly discovered that I was not really trained to teach, qualified to teach in classroom here, because of a lot of reasons. Number one, my teaching subject was history. History is a very highly intellectual subject. I can't teach it unless I know the context of the history teaching here. And that cannot be done unless I study the syllabus, go to school, get oriented how to teach here. That was one. Second thing was my grasp of the lingua franca, the local language, the local expressions, I didn't know. And I can't go make myself funny in front of the kids.
When we go on to do an assessment in the workplace, it helps us as an assessor to always start our professional conversation by asking the individual to present their story. I think it's so important for us as assessors to listen to that story.
I'm from Sierra Leone, and Sierra Leone is actually a British colony. So it's basically the education from probably Kendi, it's English. I was fortunate enough to win a scholarship to travel to another country to further my studies. Then I went to Egypt, studied there for some time, and then I studied in Egypt. I did my university studies there and worked with a lot of the refugee communities there. So as a volunteer working with other agencies and also working with another community called Community Care there in Egypt was very challenging for us, because you got to not only talk to them to be patient, but also listen to their traumatic stories. And you do you do counseling, you do mediation between groups, you do sessions, you do everything. So you're not there just to specify in one role, but you gotta go across the board which was very challenging, yeah, and very good experience.
We sometimes just sit there amazed at the life experiences and some of the, rich, even work experiences that these people bring to these jobs. And when we think about it, we're saying we're only assessing them here for a certificate 4, but these people bring a lot more.
With the refugees that in that part of the world, they're all in a situation whereby they all want to seek a third asylum place. So, and they're coming from different parts of the continent. So I was very fortunate to gain a lot of skills of refugees coming, not only from the West Africa, but also from the other part of Africa, like from Sudan, Eritrea, Ethiopia, and Somalia. So there was a lot of other refugees that I was mingling with, trying to learn their issues.
It's a life-based learning model where we talk about an individual not merely learning, say in a formal learning organization or in their workplace, but we learn there are many other learning ecologies that an individual is exposed to. It could be family, it could be, your leisure time, it could be other life experiences.
One problem was I never knew how to transform my skills, how to interpret my skills and my experience into reality in this place. So I had to meet someone who understands the local setting. So he helped me. Many things I did, I didn't know how useful they were. He helped me to translate them. I started feeling, wow, I think I have skills and experience, I can work here.
It's also being responsive to industry needs. I think that industry has a need to have a trained and credentialed workforce. It's got people doing the jobs, but they haven't got the formal qualifications. And it's also got people doing the jobs because they have life skills, but they need some gap training to understand Australian society and current conditions. So we're responding to industry's needs to credential, to gap train and assess with a practical demonstration rather than an essay or something like that.
What you're talking about, Fatima, I think is great to demonstrate how important research can be for actually bringing about change, because you're talking about interviewing people, finding out these stories, gathering evidence, like being able to actually document through photographing, the situation you're describing, and then actually being able to know who to go to actually try and get some help in that situation. And you mentioned working in partnership with New South Wales Refugee Health Service, which is obviously a really key way to try and address some of these issues, to bring in the appropriate government agencies. So I'm really happy to see that the work you're doing and the research and the results are definitely meeting, the outcomes that particular undertake research activities as a unit within your study, that you're actually fulfilling those requirements. But more importantly, you're actually out there in the community working in a real situation and hopefully going to bring about some change.
And I think that's so important, because someone who's kind of experienced that can really empathize with an individual or a client who presents those issues better than someone who's been here, trained locally, has fantastic skills. But I think when we talk about empathy and being completely able to understand the issues from the client's perspective, some of these people are able to do that better than, say, someone who's trained here. So that is a unique skill they bring.